Hey everyone, Finish First is offering online nutritional blueprints to meet our patients' needs and demands. We tried to make this as easy as we could, so we broke it down into 4 templates. So I want to review those with you because when you see the option to purchase these online, I want you to know which one is best for you so that you can, get the biggest bang for your buck. So you're going to see online that there is a Mediterranean low carb. So what does that mean? Well, for those of you who maybe have a history of heart health concerns, this is going to be the diet for you. So it breaks down some of the optimal fats in our diets that maybe some of you have thought before, like, okay, I'm not supposed to be eating my egg yolks, or things that are higher in cholesterol. We know now from the research that that's not really the case. We just need a healthy balance of our optimal fats. And with our optimal fats, less sugars and carbs, because that's where you're going to really see that blend cause some concerns in our health. So the Mediterranean low-carb diet does that for you. It eliminates a lot of processed foods, like I said, so it takes out a lot of your sugar, refined oils, a lot of things that come in a box and that we know, can be, detrimental to our metabolism inside. And then it also optimizes nutrient absorption. And what that means is it takes out a lot of the whole grains. You might question that because I know the American Heart Health Association says, an optimal heart health diet has a lot of whole grains, but let's just think about this for a second. We know that whole grains actually can decrease the absorption of really good nutrient-dense foods if we're eating them all the time. So with the Mediterranean diet, you'll find that those are very limited, but they're there as an option. And so it helps us really just get the best nutrient absorption for our bodies with the foods that we are eating. So one of the next ones we're going to go to is the Paleo autoimmune, and those are specifically geared, this template, for our autoimmune patients. And what it does is it eliminates the inflammatory trigger foods. So, it does take out some of your grains, some of your dairy, all of your grains and dairy, and a lot of those foods that people don't even know can cause inflammation in our joints, like nightshades. And if you don't know what those are, buy the template because you'll find out. It's also meant to use only for 30 to 90 days. So the autoimmune, because it's restrictive and used as an elimination diet, it's not meant to be a lifetime diet. You actually will cause harm if you stay on this diet forever. So what you're meant to do is reintroduce trigger foods after the 30 to 90 days. And while you're doing that, make sure you journal about what you're experiencing when you introduce one trigger food at a time. I roughly say like one every 3 to 4 days, introduce it, journal about how you feel, how your symptoms are, how your sleep is, how your skin is, and that will tell you if it's a food that you should keep out of your diet permanently or allow to have in moderation. And then it maintains the paleo approach, meaning that even after I've gone through this elimination and brought some foods back in, I'm ultimately going to keep the foods that are very inflammatory at a very minimum. So maybe every now and then, if I've gotten my body to a point where I can handle a tiny bit of gluten in some foods, I know I won't respond because it was just a tiny bit and I don't have it every day. And that's what maintaining a paleo approach means. Then if we move on to our regular modified paleo template, we called it modified because we do believe that everything should be in moderation, even moderation should be in moderation. And so what it does is it basically gives you a template. It's not a diet, meaning that there really aren't any strict rules and regulations. It's just a guideline. It also provides some of the most nutrient-dense foods, and so you'll find some foods that maybe you're not familiar with eating that you have to learn how to cook, and that's okay. It takes time, but I think that you'll find, that you're feeling better overall on it. And so because it has a lot of nutrient-dense foods, it decreases overall inflammation. It can target weight loss. So we know that a lot of people don't lose weight because their bodies are so inflamed that the body doesn't even know how to let go of that inflammation. It's almost like stored in excess adipose tissue. And so if you get rid of the inflammation, you're going to see a weight loss. The last thing too I have on here is that it can reverse chronic diseases. I'm not stating that, this diet or this template, what I would call it, can completely take you off medications. We're not saying that at all. What we're saying is it provides a foundation for those chronic diseases, like maybe type 2 diabetes, that actually allows the medication to maybe work better, or eventually after talking to your doctor, you can decrease the dose, or maybe eventually get off of it, but that's also not the goal. So remember, it just helps aid a healthy body, which we know in an unhealthy body is where chronic disease lie. And then finally, we have our competitive athletes. So you're going to see on this one, there's really not a lot of restrictions at all because as an athlete, you are burning through your metabolism constantly. You need a lot of fuel. You're performing at peak hours. You know, I mean, you're probably putting in 3 to 4, sometimes 5 hours a day competing. So if you're not at what we call a competitive athlete, meaning that maybe you just work out an hour or 2 a day, this really is not for you. You know, you may do better on a modified paleo where you have carbohydrates for fuel, but this specifically is targeted on what we said, enhancing recovery, improving endurance, and sports nutrition, meaning you're going to find whole grains in it. You know, you're going to find some of those simple carbohydrates that they absorb into the body very quickly for energy. So if I'm about to go run, you know, 13, 20 miles, I'm going to need really quick sources of glucose to fuel that. And so this provides it for you. Although we say a healthy competitive athlete, because if you are an athlete that has a lot of gut issues, it's really hard to eat this kind of a diet with little restrictions and maintain optimal gut health for performance. And so if you fall, you know, in one of these categories, but you're not quite sure which one is for you, just give our office a call and set up a consult and we'll direct you. But you know, we wanted to provide enough online for our patients' demands because we're getting a lot of nutritional, you know, appointments and questions in the office. And so we want to provide something for you that's easy and accessible. So again, give our office a call if you have any questions on this, and we look forward to your feedback on how you like the templates online.